This is Dr. Estie Hess,
And I'm Dr. Ann Kirsch.
and we're speaking on the spectrum. On and off the spectrum.
On and off. I was just going to say on and off the spectrum. And tonight we'd like to talk about some things that have been going on around our country. And they're very difficult things that everyone in this country, everyone in the world has been affected by.
Right, and because it wasn't just in the United States. Over the last 12 hours of last weekend,
Exactly.
there were 4 well-known horrific events that impacted the world. A variety of different religions and cultures, and we're going to speak to all of that. And the question of how do you as a parent navigate this kind of trauma on top of trauma on top of trauma on top of trauma and help disseminate that for our children?
Absolutely. You know, we tend to think in terms of the bubbles that we live in. We tend to think in the terms of our community. We tend to think in terms of maybe a larger community. Maybe we think in terms of the schools that our children go to, or the people who live down the block. But what has happened in the last 12 hours, in the last few weeks, has thrown everyone for a loop. Everyone has been affected. Everyone has been thrown up in the air because what has taken place in terms of the murders in colleges, in terms of the people who have been violently hurt, violently taken from us, from the families, from the people that were their parents, were their children, were their loved ones. Everyone has been hurt.
Well, so maybe we'll speak specifically about the different events. Over last weekend,
Right.
within a 12-hour period, there were horrific murders. There was killings on Brown University's campus, and I believe the understanding is the same individual who did those murders also murdered a professor on the campus of MIT.
Right.
And later, actually, himself was found dead, and the police discovered. But a few hours later, at the very first night of the Hanukkah holiday for those of Jewish faith, there was in Sydney, Australia, on Bondi Beach, a horrific massacre where a gunman opened fire. Actually, a father and son gunman opened fire, and they killed 15 individuals before they were stopped, and I believe injured 29 other individuals, including the young rabbi from Chabad who had organized a candle lighting ceremony on the beach. And then, and it touches us specifically, well, it's a global issue, but we in Southern California, and impacted so much by the Hollywood community, were just reeling from the terrible murders of Rob and Michelle Reiner, and the horrific news that their son had committed, their son Nick had committed these murders. And the question is, how do parents handle the delivery of news when their children are being exposed so often through social media, through a variety of different exposés, a variety of different focuses of possible content ingestion? How do you go ahead and protect your children to provide them the developmentally appropriate way of disseminating information so that they don't walk around panicked and they have a grounding understanding that they're safe and okay?
You know, it's a very important point that you make, Estie, because someone said to me earlier today, I think we're beyond the point of safety. And I was kind of taken aback by that, because my point of view as a therapist, I think our point of view as therapists, is that there's always hope. There's always a place where people can reside emotionally, where there's a new place where we as parents, as therapists, as whoever we are in the world, we can always think, not that that won't happen to us, but that we can find a way to come out of this. But the person I was speaking with said, I think we're beyond that. And the reason we're beyond that is because it's gone on for so very long. And when I said, well, tell me more about what you mean about this, what do you mean about it's gone on for so very long? This client said to me, look at how many years. Look at how many years, she calls me Dr. Ann. Look at how many years, Dr. Ann, we've had murders in this country. Look at how many years we've had complete access to firearms, bigger, better firearms. Look at how many years people have had access of all ages to firearms, to the extent that you could be a young child in middle school, you can be an older person in their 20s and 30s, you can be an elder in our communities, and we're not safe. And this was the question that was put to me. How do we keep ourselves safe? How do we, as Estie is saying, how do we protect our children? How do we keep them safe?
Right, and I think, I'm sorry to interrupt.
No.
I think, in terms of the various types of murders that were committed last weekend.
Yes.
If you're a college-age student, then you're maybe even more interested in the Brown and MIT murders. If you are, again, a person in the Hollywood community, or a parent with evidently a mentally ill child and wondered,
Yes.
does my child have the capacity to harm at that level, or how do I make sure that both he and I are safe? Or again, someone who watched the beloved show All in the Family and remembers Mike, who played the meathead character, and now he was a 78-year-old man and a father of 3, and murdered by his youngest son, he and his wife. And how, if you are a person of faith, whether it's Jewish faith in the celebration of Hanukkah, or really any person of faith who understands the sanctity of a religious ceremony and having that ceremony intruded upon by violence, and yet wanting to maintain the sanctity of the experience. I think we have to discuss how to approach addressing trauma at various developmental levels, at various ages. So, for example, Anne, what would you tell parents if they have, college-age kids? All right,
Mm-hmm.
here was these murders at MIT and at Brown, and how would you, we know that there's enormous violence on campus in the sense of not necessarily being safe, but how would you discuss this advise parents to discuss this issue with their children, with their older adolescent, young adult children, in terms of both the occurrence of what happened and also to try to give some sense of both comfort and safety?
It is kind of mind-boggling to me now, because I have one of my children has been through college and is now middle-aged. And when that child was in college, there was a person on their campus who committed suicide. And it was the first time that I had ever witnessed my child in such pain, such distress. This kid had never known anyone who had done that to themselves. Had known, I'm not saying that they had never known anybody who was angry and frustrated and all the things that happen in normal lifetime, but this was the first time that they had ever called me and said, "Mom, there was a kid on our campus. They threw themselves off the second, third floor balcony of their room." And it was so shocking to me to hear. We've all heard about these things as adults, later in our life as adults. I never thought, in all my wisdom as an adult, I never thought that I would ever hear one of my children say, "Someone I knew killed themselves. I knew this person. What do I do?"
So how do you assure safety, or if your child has yet to come to you with the information, perhaps you heard an earlier edition of a broadcast, and you feel it's important for your college-bound student or college-age student, in terms of whether they're actively, in terms of if they're on campuses now, how do you present this information in a way that is intelligent, thoughtful, and supportive?
It's beyond my mind to think of how you actually support that person, a college-age person, except to be there. And what I mean by being there, and we all say that to our children, "I'm here for you, I love you, I care about you," but what does that actually mean? For me, as a mother, for me as a parent, as a therapist, and as someone who works with clients every day, what I said and what I continue to say is, "I'm here for you. Tell me what it was like. Explain where you were. Explain what the situation was. What was your relationship with this person? What did you and your friends do? How did the school handle it? In essence, how did you and the people around you in your school community, how did they help you to feel seen, to feel like you could say anything you wanted to say? How did it happen?" And what that conversation turned into was a very modern and a very painful conversation of, "Mom, I never thought I'd ever hear about that. Now I know kids who are in younger ages of schools who are being told how to survive. Children who are younger ages, they're being told how to survive when someone has hurt themselves or been hurt when they're 7th grade, 8th grade. I never experienced that. What do I do? How do I help?" What this person said, my kid said to me was "I want to get out there. I want to help people. I want to know what to say. I'm calling you because I don't know what to say." And what my response was, "No one knows what to say. No one knows. But I'll help you the best I can. If you can accept from me, your mother, who's supposed to know everything, if you can accept that no one knows what to say." And then we had a long, far-ranging conversation about what does it mean as you go through each generation of your life. What does it go through to feel like you don't know what to say, and you'll do the best you can. You'll feel the pain that you feel. You'll feel that you don't have a clue about how to help, but knowing that you don't have a clue means that you use what you know to figure out what you don't know. And that's the best you can do in your life at that point in your life, at that stage. Use what you know to figure out what you don't know.
Okay, so what I'm hearing though, as a parent, I think the first step is to get grounded yourself. In other words,
Yes.
if you are hysterical with this information, and it understandably can trigger something in you, and particularly if you have experienced some point in your lifetime some form of what we understand as PTSD in terms of post-traumatic stress disorder, where you would be experiencing flashbacks from a trauma, earlier trauma, that any one of these sequence of traumas might have triggered. But if you're not sound and secure, your children will take the cue off of you either way. So we want to be in a place where you know what happened and you are making yourself okay enough to be able then to transmit the knowledge, whether it's to sit down with your college-age student and to say, as Anne, you said brilliantly, know what you know so that you can figure out what you don't know. Be able to ask the questions, but be able just to talk about this thing happened once again on campus, because it's not just the occasion or the incredulous kind of experience of suicide or homicide. It happens a lot. So it's almost, unfortunately, it almost becomes routine. So once again, there has been an invasion, a tragic invasion, and then to be able to talk in cogent terms that your child understands, that with permission to ask questions, permission to be sad or scared or angry or whatever is going on, then to see, for example, how can you offer support if maybe there is on your college campus through the counseling department some way of supporting the students at Brown University or the family of the MIT professor who was killed. And that's another way that you can feel back in charge of an out-of-charge situation.
Well, I'll tell you, one of the things that what you've caused me to remember is that what I have said recently to my clients is, you'll never be prepared for murders, killings, people who do shocking things to people you don't know, you have heard about. You'll never be prepared to know what to say. You'll never be prepared to say, yes, I remember when that happened to me. Because for most people in this country, in this world, these things don't happen. But it happens far more than we know. And in the world that we live in, these kinds of murders, these kinds of indignities that we face from person to person, we face them all too often. And so one of the things that I find myself saying is a lot now is, what would you say if you were me as a therapist, if you were talking to your child, if you were talking to somebody in your church, in your synagogue, in your neighborhood, if you were talking to someone close enough to you that they could knock on your door at 10 o'clock at night, which has happened to me, and say, what do I do? What happens now?
Well,
I'm afraid to go out.
I'm going to introduce you to somebody for a second now, because we just heard her bark at the
Yes.
door. That's our
Yeah.
therapy dog, Elsa, who herself actually had just had a little bit of canine surgery. She's fine, but I hear her whimpering, because that's another way to offer comfort. Let me let her in so she can be part of our conversation today.
Yes. I saw her when I came in, and I thought, this is a perfect time to have Elsa as part of the conversation. Hello, baby.
Yeah.
Elsa has a cone around her neck, as we know dogs and cats have when they get surgeries or procedures.
Right.
Tell us what's happened.
Well, no, she had some cysts removed, so thank God, not too terrible, not too terrible at all. Yeah, but it's also, we know that when an individual pets their cat or dog, what gets released both for the individual as well as for the animal is a neurotransmitter, which is called oxytocin, which is our feel-good chemical that naturally occurs in our bodies when we allow for social connection. And that's another wonderful way for us to learn how to cope through tragic circumstances. And we might say, let's bring our family dog or cat or other pet into the conversation, and let's hold that individual as we go ahead and discuss hard things. So that's another kind of coping device while we are beginning to translate developmentally appropriate information to our family member. There's been other points of discussion because, again, so many tragedies happened, in sequence. The incidents in Sydney, Australia, people will discuss, the anti-Semitism part, and I actually think there was something quite remarkable that happened, which I think needs to be spoken to with our children.
Absolutely.
That although evidently a terrorist group was promoting the murders in Sydney, this father and son who were part of the larger ISIS organization, evidently, there was one gentleman who himself was a Muslim who was a hero. He actually saw what was going on the beach, and at great risk to himself, in fact, he was quite seriously injured, he grabbed the gun, the rifle from I believe the father figure, and wrestled it away to prevent further murders, which is remarkable, absolutely. And I think the fact that he was a man of his own faith in the context of this tragic faith-based murder was so important, because it speaks to that there are good people all over the world of all different kinds of faiths. And that's another way to describe this information, to disseminate it, so that your young person who's receiving this information doesn't have to feel that the world is so totally a hopeless, scary place. There are scary things, but there are still wonderful, good people in there who want a better, safer environment, as this wonderful gentleman who really was the hero in that context of what tragic day.
What you're saying right now, Estie, is so important to say out loud to all of the people who are listening to us, because of one particular thing. Everyone on that beach saw a man not of their faith, wearing a head covering, not of their faith, and they grabbed the person who was hurting, killing other human beings, and they didn't stop to think about themselves. In fact, if they thought at all, they thought, this is wrong, this can't happen, this has happened too much, I know what to do, I know what to do. And what did he do? he did what Essie said. He jumped in. He took charge for whatever he could. He took charge. And what did he do? Could you or I have done what he did? He grabbed the man who became a murderer and he held him until he could be taken by police officers. He held him until before he could do further misery and harm and murder.
Yes.
He held him.
So there are both horrific stories but remarkable stories.
What did the children around? This was a vast group of people of many faiths, of many backgrounds,
and many,
who watched.
And many ages.
Because
many generations were killed, and another, there was as young as a 10-year-old child who was murdered in addition to a Holocaust survivor.
Mm-hmm.
So the gamut of generations. But I think we can discuss gently in terms that children understand about the concept of anti-Semitism, but also the concept that there are good people, as provided by this wonderful example of heroism. The last piece I want to discuss this evening is so painful because aside from the fact that Hollywood celebrities unfortunately tend to get probably more press than maybe they themselves would want, but when something as tragic as a murder happens, and worse, a murder by your own child, it touches the heart of everyone, and particularly if you are a parent with a child who has a mental illness and wondered, will this child ever harm someone else? Will they themselves be able to stay safe and not harm themselves? And then to hear about the Reimer murders, the homicide by their son, who unfortunately evidently had been diagnosed with, I believe it was schizophrenia. Although
right. That's as far as we know now.
That's true. I mean, the trial will come out in the beginning of 2026, and we'll hear, obviously, more details. How do you assure parents who might have children who have either a similar diagnosis or they themselves are worried about either themselves and that diagnosis, or that they would have a child who they don't know how to help, or not sure if that child is safe to be around? Again, how do you offer support?
That's one of the biggest questions there is for people like us who work with families. When you're working with a family and they call you, parent calls you and says, I need help. I need help because there's something wrong with my child. My child is 4. My child is 8. My child is 17. My child is 22. Whatever the age is, I need help because they won't let me give them help. Mm-hmm. They won't let me get them therapy, get them medication, get them help of any kind. Mm. They'll yell at me, they'll scream at me as a parent, they will thrash about, they will tell me that I'm the one that's wrong, that it's because of me as a parent that I am the reason that something is wrong. You're the fault. Mm-hmm. You're the fault. It's your fault as a parent. There are millions of parents who have been told that they are the parent. And when you're told that as a parent, as I was told, and probably you have heard this, when you're told that it's your fault and you
that your patients have shared
exactly
that they are the parents, unfortunately, of a child who's mentally ill, and they will